Assalamu alaikum. Hope all of you are doing well. So today's our topic is regarding the basics of first aid. First aid is as easy as ABC, airway, breathing, and CPR card. Resuscitation is included in this. We can simply say that. So moreover, in any situation, apply the DRCBD and action plan. We can include in this. Always check the danger to up to you that. So the basic steps of first aid include danger response, send for help, airway, breathing, CPR, defibrillator. So the ensure safety in this, call for help first, then assess the situation, and then fourth step is the provide basic first aid procedures if necessary. Step 5, provide comfort and reassurance place. Step 6, head over to professional medical help as they arrives. So we can include in that some knowledge of first aid could be in the difference between life and death. Consider doing a first aid course so that you will be able to manage if someone is injured. You will be able to give him bandages. CPR is a life-saving skill that should one should love. Keep a range of first aid kits handy at home in this car. Learning basic first aid all techniques can help you cope with an emergency. You may be able to keep a person breathing, reduce their pain, and minimize the consequences of injury or sudden illness until an ambulance arrives. This could be the main difference between life and death for them. It is a good idea to take a first aid course so that you can recognize an emergency and give basic first aid professional as help arrives. So dangers always checks the dangers to you, any bystanders, and then the injured or ill person. Make sure you do not pull yourself in danger when going to the assistance of another person. Response is the person conscious. Do they respond when you talk to them? Touch their hands or squeeze their shoulders. Send for help. Call 000. Don't forget to answer the question by the operator. The operators ask for your address, where are you, where the person are injured. So tell them all the answers. If the person is responding, they are conscious and their airway is clear. How you can help them with any injury? If the person is not corresponding and they are unconscious, you need to check their airway by opening their mouth and having a look inside. If their mouth is clear, tilt their head gently back and check for breathing. If the mouth is not clear, place the person back on their side, open their mouth and clear the contents, then the head, and check for breathing. Breathing checks for breathing by looking for chest movements. Listen by putting your ear near to their mouth and nose. Feel for breathing by putting your head on the lower part of their chest also. So defibrillator for unconscious adults who are not breathing, you can apply an automated external defibrillator, AED, if one is available. They are available in many public places, clubs, and organization. An AED is a machine that delivers an electrical shock to cancel any irregular heartbeat, arrhythmia in an effort get the normal heart beating to re-establish itself. The devices are very simple to operate. Just follow the instructions and pictures on the machine and on the package on the pads as well as the choice prompts. If the person respond to the defibrillation, they turn out into their slide and tilt their head to maintain their airway. Some AEDs may not be suitable for children, so be clear first. So it's the infection control when performing first aid of a person choking, first aid for a medication for a overdose. So first aid kit consists of many equipments by which you using their that equipments you can easily manage this. So this is the two ends together firmly at the person's fingertips.